Hi, hello, welcome back to my channel. Actually, this clip I have recorded on 29th of December because I was going for an iron transfusion. On the I was bleeding very heavily for months and months, and I had lots of treatment for this, but nothing has been worked out very well. I mean, I can't say nothing has been, but we have tried. Even my doctor and myself tried all other procedures except hysterectomy because. As you all know, there are lots of problems will occur after the hysterectomy, and I am not that old, and that's their concern. So. I had ablations and sonato, and both of those procedures proceed through the vagina. Didn't had any incisions made on my tummy, and I have been prescribed lots of medications as well. But I am keep on having that low HB and low iron, and that makes me I was a bit emotional there because I was going for iron transfusion 4 days before my surgery, and I'm really concerned because low HB is not good for the surgery, and um, I wasn't very well. I was feeling very dizzy. I was in lots of pain, and the problem is in the UK is when it's Christmas and New Year, most of the main offices like receptionist don't work usually on the Christmas time, or the senior person like band 6, band 7 consultant, they all who are getting salary, they don't usually work on this Christmas periods. That's where there will be lots of delays for communications, and because I was bleeding heavily, I was very dizzy, and I couldn't go to work. I was off sick since December 15th, and I checked my HB by using my machines. Then it shows that I only have HB of 63. While I was recording, my fridge Alexa is talking. I don't know. Then I have phoned the GP. That's a group of doctors sitting in their place, and each patient has their own doctors. So the family has got one doctor. So myself, my husband, and my son has got one doctor. I phoned, and the receptionist answered the phone, and I have escalated my concerns to her, like I was bleeding heavily, I'm very dizzy, and when I checked, my HB is low, and I couldn't go to work, and my surgery is postponed on the 31st of December. And she said, okay, you must speak to the doctor, and she asked me to fill the e-consultant form. So she sent that to me. I have filled it, but I haven't filled all other details. Otherwise, maybe they could have I have a message that I need a blood request form, like a full blood count, and usually doctor will phone within 1 to 2 days, but if it's emergency, they call straight back in 1 day. I was expecting their call, and he didn't answer me call me at all. After 3 days, he sent me a text that I think you definitely need a blood form because previously you are you had a chronic anemia. So I will issue the blood form. You have to just call the reception and book an appointment. When I called the reception, they told me that they only have appointment on the 5th of January, and I said my surgery will be on the 31st of December, and it is not very good if I have a blood test after the surgery. I don't need that one. I need before that because I am very dizzy. I couldn't tolerate. I couldn't walk at home properly. All that. So he said, okay, he will issue the form and I can take it somewhere else to take the blood. So it's the nearest place is QA Hospital and St. Mary's, and I was very busy and my husband was at work, so I couldn't go and do it to St. Mary's, and my husband was working for 3 days, and so when he went to collect it, and I went to QA hospital to do the blood test, and as soon as the blood test done, it was my HB was 91, and then doctor responded me after 3 days, my GP, okay, and he said, yeah, you have to take folic acid 5 milligram. I said, I am already taking the folic acid that I was taking actually 15 milligram, okay, when I was bleeding, yeah, it was not maintaining, and I was consuming all the fiber rich food, and but my iron was very low and it's not storing in my body, okay. So I thought the doctor will prescribe iron transfusion. Previously they did that. As soon as my blood test done, he just asked me to do the iron transfusion, but at that time HB was 75, but this time they thought they can manage 91 without iron transfusion. Anyway, then I had a pre-op and I escalated to the nurse, and even nurse knows my blood results, and she didn't do another blood test, and she said because it's the blood test has been done 3 days before, but she will escalate to the doctors for urgent review of my blood, but nothing has been happened. When my surgeon came on the Friday after the leave, he said I need to have iron transfusion urgent. So then I went to the gynae ward, and I have done the I have been transfused iron. They have given me iron transfusion, and usually after the iron transfusion my HB level goes up very quickly. So I thought I still have my surgery will be my surgery postponed on Tuesday, and I had my transfusion on Saturday. Then I went on the 31st for the surgery. They prepared me everything, and I have changed into gown, and I waited in this room, but before that anesthetist wasn't very happy, and she asked to do a repeat HB. When they did the HB, and the result came after 30 minutes to 1 hour. I said my HB dropped before that iron transfusion. So and because on the 30th onwards my I had a bleeding, and the blood the HB has dropped further down. So I think it has been dropped to said 89. And then the anesthetist wasn't very happy because of the high risk. She said she can only do this. She can only give anesthesia if my HB level is 100, and on the top I am bleeding, and I'm known to chronic anemia, and it's very high risk. If she gives me anesthesia, I won't be breathing well. She said I can. There's a risk always in it, so I can die. I won't be breathe properly. I need to admit in surgical high care, and she said that I can't have blood transfusion very quickly. I need to have slow blood transfusion, all that. Anyway. So then they asked me to discuss with my husband. I discussed with my husband and friend, and they said just try to tell the doctor, because have been suffering for this so long. I can't take the risk. Please do the surgery. Even though I'm taking all other medicines, the primary cause is still there. But even 3 times of conservation. Sorry. The talking, the anesthetist wasn't very happy, and they come with a good plan, and the doctor said I have to take tranexamic acid. I was taking previously, then I have taken all the prescribed medication, then I didn't have any more prescribed, so take your tranexamic acid, and on the top of that hormonal tablet, that's Provera, that's like stop the periods. So that's a good plan, like stop stopping the bleeding and stopping the periods as well. So can manage the my HB and iron level. Okay. Then they said 3 days before they will do a blood test 3 days before my surgery, and if it is remain low, they will do a blood transfusion and they will find another surgery date. That's what that was the plan. So when I come home, I was bleeding severely, and even though I'm taking the tranexamic acid orally, then I was feeling very dizzy after third day. Then I emailed my consultant, my surgeon, and he didn't reply on that day. But when I was lying down on the sofa, I wasn't able to even get up. My body was very weak. I was very dizzy. So when I checked my HB, it was 55, dropped further down. Then after doing the HB, I have sent the message to my surgeon. Okay. Then I haven't received any reply, but then again I was feeling very dizzy. That's why then I just thought maybe I will go to the gynae, because a doctor already given me open access to the gynae. That means I can go to the gynae ward any time when I'm not feeling well. I like heavy bleeding or pain or anything, I can just go. Otherwise you need to make an appointment and that may do the admission and all. So I went there. I thought because in the evening we don't do the blood transfusion or iron transfusion. That's why I went there, and the doctor quickly done the, after third attempt, she managed to get some blood test, and she said they will do the blood transfusions, and she sent the blood, but the result came after 5 or 6 hours, and she said that the blood test come back as 89. I don't know, I haven't seen that, but anyway, it's still the same. That's what they are saying. But I don't know, it was 89 or below or 85, I can't remember that. Anyway, they start, I have another cannulation done by the ED staff. Then I had the the tranexamic acid IV. That is a very good decision, because oral tablets take so long to have the effect. But as soon as I had the tranexamic acid, after second dose, my bleeding has reduced, and it was very slight bleeding. And the next day doctor came to see me. They have admitted me on that night, because doctor said I will have the blood transfusion during the night, but they were short staff and they haven't done the blood transfusion. I was waited all night. The next day doctor came and said, and I told my surgeon that my bleeding has reduced, and I still had the pain, and I was taking mefenamic acid and paracetamol at that time. But he has told me that he will prescribe some codeine that will control the pain. Then he said he will observe me until the afternoon and do another blood test. If the blood test is fine, then I can go home. I was very happy. I called my husband, and I had, because all my cannula, and I was still a bit dizzy, so I had a shower and get dressed and ready to go home, because I don't like to stay in the hospital, because I'm working there and I don't like to be stay in the hospital alone. I'm not very comfortable to stay in the hospital. I like to do things at my home. Then they did the blood test, and the result come back as 81, and the blood, even though I had all the tranexamic acid and transfusion, my HB dropped to 81, and the doctor still have a bit confusion, and she was saying we don't usually transfuse blood if the patient have 81. If the HB need to be dropped below the 75, then only we transfuse the blood. So my surgeon was in the theater. He was in the theater for all day, and they couldn't take the decision. And she said I have to manage at home. I take the iron tablets, and when I'm taking iron tablets, I usually have a constipation, and she said that she will prescribe some Movicol, and same time I already got mefenamic acid and codeine and tranexamic acid orally, and I said I can't do that because I'm very dizzy and my husband is going back to work next week, and my son will go to school. I will be alone, and when I'm walking I'm very dizzy and I'm still having that pain. The pain is not managed to at that time, so I'm not very comfortable. I'm not confident to stay my own at home because something had happened. It's not very good, and I'm bleeding as well. As soon as I seen the doctor, the bleeding started to heavy again. So it's not a proper solution. It's not completely resolved. Then my husband was getting a bit angry, so because he said he's not very happy either, because he was very tired of, not tired, like he wasn't very happy to look after me. I mean, he's not very happy when I have my HbA1, because that's not a good thing, because I am symptomatic and it's not safe for me to leave me at home. That was his concern. Anyway, the nurse who was looking after me texted the doctor, and the consultant in gynae, she texted us to the surgeon as well, and he was very happy to transfuse 2 units of blood. Then I had a 2 unit of blood transfusion on that day itself, and I felt so much better, when you are walking or sit in, my head was like round and round, and it's not very comfortable when you are walking. You feel that you are going to fall over. That's not very good thing. Anyway, I had the blood transfusion. I had all the tranexamic acid. My cannula was actually very painful, but I don't even wanted to say anything because I just wanted to have all the medication, that cannula, because they had attempted so many times to cannulate me. I don't know, I was dehydrated, or my because of my HB was very low, and even I had 3 Irontransfusion. Sometimes that cause difficult to for the cannulation. And then the next day, they discharged me with lots of medication, and I'm taking all this medication, and doctor told me that he will find another surgery date for me. The thing is, I think there was a little bit problem with the communication. I am able to contact my surgeon through our work email because I'm working in the same hospital. I always email him, but what I was thinking that because it's a Christmas holiday, because he's a consultant, he's a doctor, he always get he will be leave. Usually he is on leave during this holiday, so I don't want to disturb him. He has his own life, so I thought the GP should do these things, isn't it? That's why the GPs are there for. But GP hasn't managed it well, because he should know the tablets won't be cure my problem, because I'm going to have a surgery. If I'm not having the surgery, that should be fine. I can take the folic acid and it will maintain slowly, but my case was different. So that's one mistake, and my mistake was I could have emailed my surgeon, and whenever he's free he could have seen that. Even the pre-op nurse escalated to the doctors, but no one looked the result and did anything. So, and the 4th day before my Irontransfusion hasn't done much difference, and because of the bleeding. When I came home after the Irontransfusion, I checked my HB. It has come up, actually. It has come up to 102. So I was very happy. Then I thought after 3 days it will come up more than that. So I wasn't much worried. But unfortunately, Rajesh was working for 3 days and he was very tired. And my expectation was my iron and HB will be normal. That's why, but I did ask Rajesh to do another blood test, but even though that is not official, the hospital has to do their own blood test, then only it will be official. But I haven't done. If I have done, then I could have tell the doctor that my HB has dropped, then they could have do something else. But unfortunately, that hasn't happened. Anyway, now I am in good plan. I'm having a good plan. I mean, doctors has a good plan what they have to do. So I'm hoping I will have a surgery this time successfully, and I need all your prayers. I haven't uploaded much video, but I don't like to simply sitting at home. I want to be active all the time. Otherwise I overthink usually, then I will be sad. Sometime if I overthink, I won't be able to sleep, and that's not very good. That will drop my HB as well. And because of my swollen hands, I couldn't do much cleaning, cooking, all that. I enjoy cooking, cleaning, all that things, and sometimes we need some support. I mean, me I everyone needs some support when you are on it, you are not very well, isn't it? But I was so scared to discuss with other people, but I had previous experience that when I discuss my problems with others, they sometimes they don't wanted to listen because it's a negative thing. They hang up the phone on me. Someday they will say, oh, they are receiving another phone call, so they will call me back, but they never call me back. So I understand that they don't want to listen my problems, so I don't want to discuss with anyone. Sometimes people just kept the phone on the speaker and they don't listen anything. At the end of the time they come back, oh, okay, are you okay, all that things. And when I mention the things I have previously said, they don't even listen. So I understand that for the sake of listening, they just kept the phone on speaker and that they did all the work. Even I speak to the people when I'm cooking, but I listen to them very carefully, because if you hear somebody's problem, that gives lots of reliefs to that person who is sharing their problem to you, because that give the person lots of support. So I always try to listen the people, even though I don't have time. I'll try to listen other people their problem, because that gives them some comfort. If I know something, I will help them. If I can help them, I will help them. Or if I know any solution, I will try to say that solution. Okay, because we all are, we are living away from our family and our own country. So here we all are in a different country, and we all need to support each other when they need some help, isn't it? Because we can't predict anybody's life. Anything happen to anyone. So the life is very short. Within second you can die. I think we should support each other, listen to everyone. And I wanted to mention some things, that you have to listen to your own body. You have to understand what's happening to you. So if you are bleeding heavily, you have to tell your doctor. I know the normal periods last for 6-7 days. Depends on how healthy you are, depends on your hereditary, depends on your eating. There are lots of things affecting the bleeding. But if you know it's abnormal and you are finding clots, you have to see a gynecologist. It's very easy to see a doctor in India. But here in the UK it's very difficult actually, because it's very hard to get the appointment. Then if you are dizzy, there are lots of reasons. For me, I know when I'm dizzy, sometimes my blood pressure is low, otherwise my blood sugar is low, or my HB is low. So I always go through all these things, like, because I do got blood pressure checking machine and blood sugar, and same like as HB checking machine. So I check this one. Then when I check if it is low, I call the GP and I escalate to them, and sometimes they will respond quickly, sometimes they are not. So if so there's one symptom for low HB or low iron is dizziness. And I always have a restless leg syndrome at night, like your leg will shake without any reason. My legs will up and suddenly drop and shake a lot. I couldn't control this. Uncontrolled leg shaking is the another sign of low iron. I do always have that. Not everyone necessarily having that one, but me, I do have that one. Okay, then I do have shortness of breath when I'm walking. When I'm resting, it's not that bad, but I am talking to someone, or if I'm phoning someone, or I'm talking for 5-10 minutes, more than 5-10 minutes, I do have shortness of breath. When I'm walking, I feel dizzy and I feel shortness of breath. That is another signs of low HB. Okay, so if you feel anything unusual than your normal day, you have to escalate to the doctor. I know it's very hard to find a doctor in the UK, get an appointment, but if you are really uncomfortable or you feel like something is happening, just get the appointment somehow, because these small signs are for a big problem. So if you escalate that one at the right time, you can get the treatment quickly, and you will get ill free. So what are the signs and symptoms of major, like heart attack or some whatever. So at least get to know what's happening to our bodies. That means listen to your body very well. Why some people were asking me, why you are uploading all these videos? Why I'm uploading? Because people need to know what I'm undergoing, and I share all my problems with my subscribers, because I consider all my subscribers as my family. I share my my happiness, or if I buy something, if I do some shopping, everything I share with my subscribers. So I think it's I need to share all these things to my subscribers. But maybe I'm not looking that great in my appearance, but I try to look better when I'm doing the video. But when you don't have energy, I just come same as I'm staying at home. Okay, I didn't do much makeup, because it's okay. I think you all accept me as I am, isn't it? Anyway, and another thing is, if anybody is suffering all these problems, they need to think what they have to do. That's why I'm sharing all my signs and symptoms and what all the treatment. So sometime you need to speak for you. Sometimes even doctors can suggest all the treatments, but you can just suggest from your ways as well. Okay, and you have to consume balanced diet. Same time you have to have the food like fiber rich food. You need a protein for your body. You need a good fat for your body. So you need to consume the food like dairy products, vegetables, meat, everything. You need everything, but don't eat fatty food or fried food. That too is not very good. And I heard as well that tea and coffee is not very good to store, maintain the iron, because it will drop the iron level in our body, because it contains nicotine. So I try to reduce all the tea amount of tea I am drinking. I only have one black coffee in the morning and green tea in the evening. So green tea is not that bad. I think that's good. But when I was admitted in the hospital, I couldn't ask them to make all this my own way of coffee and tea. That's why I had the coffee and tea, whatever the kitchen staff made for me, and I had some hot chocolate that is other than hot coffee and hot tea. So I think that's made me a little bit weight gain because I didn't usually use that tea and milk and sugar, but because I wasn't very well, everybody wanted me to eat very well. That's why I felt that, oh my god, I have done 3 months of healthy diet, then I just had all unhealthy food. This bag full of medication, all this medication, I need to have it 3 times, 4 times a day. That makes me full. So I don't have that much space in my tummy to have more food anyway. But I'm still following my diets. I'm having my black coffee and boiled or steamed banana and egg or ragi dosha. But I did have some appam with the rice flour because my husband made it, because I can't say anything because he's the one cooking all the time now. So whatever he makes, I have to have it. And sometimes my friends made some food for me as well. I wasn't talking so much. Now when I'm editing this video, I'm feeling a bit dizzy, so I'm stopping in between my recording because I can't talk continuously. You may feel a bit weird about my sound. I don't know why my sound is like that. I don't have a cold or cough or fever or anything. I am feeling much better. I have received lots of phone calls and messages from my friend. I won't be I couldn't manage to answer all the phone calls and text message because sometime I'm feeling very well in the morning, then around 1 o'clock I am going down. I feel very dizzy. I couldn't talk. I am having shortness of breath and exhaust, and also I prefer not to answer any phone call in the afternoon. If I answer 1 or 2 phone calls, then I'm having shortness of breath. It's not that I'm having any problem with anyone. I can't talk too much. I think it is because of low iron. But please, everyone, please pray for me. I already received my new date for the surgery, but I don't want to tell to anybody. But I will upload a video after my surgery. Most probably when I come back home, if I can record some video, I will. I think God will listen if everybody is praying the same reason. Everybody is praying for the different people, but I believe that it's only one God, and one God listen everybody's prayers and do the miracles. So anyway, I still need your support. I will come back with more videos, and I will try to record some small videos that I can manage. Okay, but again I'm saying I need your support. If you are not subscribed to my channel, please subscribe my channel and press the notification for my updates of my videos, and share, like and comment about my videos. This is when I had my blood transfusions, and my son captured these pictures when I was lying on the bed, but people say, oh, that is not very good. But my son wasn't very happy when I was lying down in the bed, but I comfort him that I said, I'm getting very well. Sometimes small sad things happen for the good things, because if they did the surgery and I wasn't very well, that's a different story. So